know that the oral cavity is very rich in blood supply. The jugular vein just passes through that, and hence it has a very rich blood supply, and hence we can explore this oral route for gaining entry into the systemic circulation. This route becomes more important if the drug of the choice that we are working on is sensitive to the acidic pH in the stomach. If it undergoes hydrolysis in that particular pH, then we can go and explore this particular route of drug delivery. Another approach is if your drug is undergoing excessive first pass metabolism in the intestine because of the enzymes, even then in that case you can explore your buccal bioadhesive drug delivery system. Okay, now in oral cavity, where all you can place your this bioadhesive drug delivery system, so particularly the most explored areas are your buccal area and your gingival area. So where is your buccal area? So if you see this cursor here, the buccal area is where your this particular region, that is your these teeth are in coming, or you can say your gum area is also called as your buccal area. And then you have your gingival areas, which is where your teeth and your gums are in contact with each other. So that particular pouch is going to be called as your gingival area. Okay, so depending upon what kind of indication you are suggesting, depending upon that you can explore the areas. For example, if you want your drug to be absorbed systemically, or if your target action is say the mouth ulcers, in that case you can go for buccal areas as your site of action. Another example is if you are working for a local action where you have some kind of tooth pain, or your gums are bleeding, or your there is some kind of edema that has happened in your gingival area. In that case you will prefer giving a drug delivery system to the gingival route. Okay, and then your these roots, buccal and your gingival roots, they comparatively have smaller flow of saliva, and hence they are more used in your in your bioadhesive drug delivery system. Because if you talk about compare these buccal and gingival roots via sublingual route, that is the route just below your tongue, the saliva production in that particular area is very high. So there are chances that there is dislodgement of the dosage form that will happen from that particular area. So in that case, you will prefer going for sublingual tablet rather than going for a sublingual mucoadhesive or bioadhesive kind of system, because there are chances that it will get dislodged because of high flow of saliva in that area. Okay, so another factor that you should be considering, that duration of adhesion of the delivery system. So in your buccal and your gingival route, duration of adhesion is very high as compared to your sublingual region. Okay, so this was the introduction to your buccal bioadhesive drug delivery. So this is a diagrammatic representation. So here is your upper lips, then is your gingiva. So just the area between your lips and your teeth is called as gingival region. Then here, here is your buccal mucosa. So comparatively, a higher surface area is obtained as compared to your gingival area. Then this is your tongue area. Below this, if you place it, it becomes your sublingual area. And here is your hard palate, that is the hard surface that is there present just above the tongue is your hard palate. Okay, so mostly buccal and your gingival area are explored for this delivery system. Okay, okay, now we'll talk about buccal absorption of drug. Now, if you talk about how to select a drug molecule for your buccal absorption of drug, you first need to be aware about what all properties your buccal mucosa or your gingival mucosa have, and according to that, you have to select your drug. So we all are aware that buccal or your gingival mucosa has a relatively lower permeability. So in that case, we would prefer a drug which is having a low molecular weight or a low what do you say, a low particle size or a low molecular weight, so that it can easily permeate through the mucosa that we are talking about. Then it should exhibit a biphasic solubility pattern. That is, it should be soluble in both aqueous salivary fluid as well as the lipid membrane barrier to show permeation, show penetration. So basically, it should have some solubility in the salivary fluid, and it should also have some solubility so that it can pass through the lipid membrane barrier. You can also say that it should have a good log p value for that matter, so that it permeates through the membrane that is present in your buccal mucosa. Then drugs which are high molecular weight face some issues while permeating through this buccal mucosa. So when you talk about high molecular weight like heparin or proteins such as insulin, they are not well absorbed through this particular route. So if you want to select a drug, uh, or for that matter, if you're talking about a protein or a peptide drug delivery system, then your buccal route is not a preferred route to make such kind of dosage form. Then a significant amount of drug should be unionized at salivary pH, and the drug should also not bind strongly to the oral mucosa. So you should select a drug such that, or rather, you should select a drug having a pKa such that at the pH of the buccal mucosa, your drug remains in the unionized state, so that it is well permeated through your buccal mucosa. Also, if there is a very strong binding between your drug and the mucosa that you are talking about, in that case, what will happen? It will face difficulty in permeating through the mucosa, because they both will be bounded together so well that the mucosa will not leave that drug, and it will not let it permeate through that buccal mucosa. So even such kind of interactions between the drug should be avoided. And we should all be aware that the salivary pH is between the range of 6.2 to 7.6. So we should try and finalize our drug or the dosage form which we are talking about, such that it is around this pH. Okay. Um, uh, Now, for buccal delivery, this is a drug which is administered through the mucosal membranes lining the cheeks, that is your buccal mucosa. So, when you say that your drug is delivered through a delivery, it is when your drug will be administered, or it will be kept in the mucosal membrane lining between the teeth and the cheeks. Okay. Buccal mucosa is significantly less permeable than your sublingual mucosa. So when you talk about bioavailability, you should be aware that sublingual will give you comparatively higher bioavailability, or almost 100% bioavailability as compared to your buccal mucosa. So if you are planning for an immediate action drug delivery, then you should prefer going for sublingual route. But if you're talking about a drug delivery which will give you a sustained action, you can prefer a route which is through your buccal mucosa. Okay, so your buccal mucosa will not give you a rapid action or a rapid absorption, and it will give you a good bioavailability, but not as good as your sublingual administration. Okay, next is buccal mucosa has an expanse of smooth muscle and relatively immobile mucosa, which makes it a more desirable region for retentive system used for oral transmucosal drug delivery. So, your buccal mucosa has a good smooth muscles, so the retention capacity of that particular dosage form is high when you talk about the buccal route, as compared obviously to the sublingual route. Sublingual route is covered, is under your tongue, so there are chances that because of the movement of the tongue, your dosage form might get dislodged. So it is not that it is a kind of a mobile mucosa that you're talking about when you talk about sublingual route, but buccal mucosa is comparatively immobile mucosa. Then buccal mucosa will be more suited for drugs which you want to give in a sustained manner, delivery of less permeable molecules and perhaps peptide drugs. So even though it has little bit permeation issues, you can with the help of some excipients, you can also deliver peptides and proteins through this route. However, you have to use good permeation enhancers for that particular dosage form. Get higher patient compliance due to accessibility of the cheek lining and lack of invasive measures. So there are a particular group of patients who prefer taking your dosage form through a buccal route because it is easy to administer. You are skipping the step of swallowing. So the patients who have difficulty in swallowing, like geriatric patients, might prefer using this buccal drug delivery system. And also it is kind of an non-invasive. You're not injecting anything into the blood, so it is a non-invasive procedure. Also, you have an option, if you feel or if you are facing any side effects, or if you feel like vomiting, you can anytime throw out that tablet or the dosage form that you have taken. Anytime you can remove it. So that is not an option which is available in your IV